Are you feeling confused by Medicare? I want to show you a concept that I created called the Medicare T that I've been using with my clients for years to teach them to get an understanding of original Medicare versus Medicare Advantage. So when you look at this chart, I have my clients take out a piece of paper and they actually draw a T. On column number 1, if you put down original Medicare, and on column number 2, you write down Medicare Advantage, then we can start to sort through how they're similar and how they are different. When you sign up for Medicare, you're going to sign up through the Social Security Administration. A lot of people are confused by this because it's Medicare you're signing up for. But think of the Social Security Administration as Medicare's secretary or administrative assistant. So you sign up through there, and whether you're going to go with original Medicare or Medicare Advantage, you're going to sign up for Medicare Part A, which is your hospital coverage. So you're going to write it under both columns, and you're going to write down a $0 monthly premium. Hopefully you've earned it premium free if you have 40 work credits. The next thing you're going to write under both columns is Medicare Part B. That's your coverage outside of the hospital, anything outside of the hospital. In 2024, the standard premium is $174.70. Some of you may have a concept called IRMA, where you have higher income and you're going to pay more than the $174.70. So you write that under both columns because, again, whether you're in original Medicare or Medicare Advantage, you have to start by signing up for Parts A and B through the Social Security Administration. And even if you end up going to Part C, you are going to be keeping A and B and paying a monthly premium for B. So when you start with your sign up, you're starting in the same place, signing up for A and B, but this is where you come to a fork in the road and you're going to decide which path you're going to take. You could choose path number 1, original Medicare, where your insurer is going to be the Centers for Medicare and Medicaid Services, or in the alternative, you could take path number 2 and join a Medicare Advantage plan, also known as Medicare Part C. If you remain in column number 1, then what's going to happen is Medicare is not designed to cover every dollar. So when you have a Medicare approved claim, let's say you had a service and it was $10,000, a Part B service, Medicare is designed to cover 80%. So the remaining 20% is yours. And it's an uncapped 20%, which is why I recommend that people then get a Medicare supplement policy. The job of a Medicare supplement policy only comes into play if there is a Medicare approved claim. I typically put people in either plan G or N, and that's a video I'm going to do where I get into the details between the two. But N is always going to be a little less money than G because there's copays. When you get a Medicare supplement policy, what is going to happen is you are going to have an additional monthly premium. So I often refer to column number 1 as paying up front because you're going to pay that premium whether you go to the doctor or you do not, but then you at least know exactly what your budget is, what your costs are going to be. Now, if you look above my head, you're going to see an X. The reason there's an X in column number 2 is that if you choose to go in Medicare Part C, you do not get a Medicare supplement policy. When you're in Medicare Advantage, there is no Medigap/Medicare supplement policy for you. Now, in addition to getting a Medicare supplement policy, you're going to want to consider getting a Medicare Part D plan. D is for drugs or your prescriptions. And typically there is a premium for the plan. IRMA also can apply, what I mentioned up above. And you're going to have copays and coinsurance for the cost of some of your medications. In 2024, the most you could pay out of pocket, not including premium for your drugs, is $3,300. The good news is in 2025, that's being capped at $2,000. And you'll notice here also, I'm trying to move, there is an X there because if you're in Medicare Advantage, you don't enroll in a separate Part D plan. Now let's switch to column number 2, which is Medicare Part C, or also known as Medicare Advantage. Let me give you a little structure, a little framework how Medicare Advantage came to be, because people are often so confused. What is Medicare Advantage? When Medicare was first offered in 1965, there was only Parts A and B, hence original Medicare. In the late 1990s, there was legislation passed where they introduced the concept of Medicare Advantage, and it basically gives you, the Medicare beneficiary, an alternative to original Medicare. you can go into a Part C plan. It's managed care. And the job of the managed care company is to manage the benefits as defined under Medicare Part A and Medicare Part B. So now I'm going to describe to you how Medicare Part C works. It may start to sound similar to you to the type of insurance you have when you have not yet hit 65. Typically, you're going to enroll in either an HMO or a PPO. That means there's going to be doctor networks. Original Medicare, you can see any doctor in the United States who accepts Medicare. With Medicare Advantage, there will be these networks. Typically, when you're in a Medicare Advantage plan, you're going to have a $0 monthly premium. But what are you doing in exchange for that $0 monthly premium? You're going to have something called a MOOP, a max out of pocket that you can spend. That's going to be defined by your plan. With this MOOP, and it's different than a deductible, you don't owe it all up front. You're going to have little costs that you pay as you receive services. So for example, if you went and you had a 3-day hospital stay, and let's say the plan defined it as a $300 nightly copay, that means you're going to owe $900. And now if the MOOP was $4,000, it's now down to $3,100. Now, in addition to this MOOP, you will have copays and coinsurance for your medications, just like what I described here. Because what happens is the Part D plans are built into the Medicare Advantage plans. There also are Medicare Advantage plans that do not have prescriptions included in the plan. A lot of people get excited at the concept of Medicare Advantage because of the $0 premium and because of all the different perks you hear about, dental, vision, and hearing. And yes, those are good things, the perks. But what I always try to explain to people is don't choose your healthcare coverage because of the perks. Figure out which path is right for you. Figure out with the Medicare Advantage plan, are your doctors in network? Are your drugs cost effective under these plans? Because if they're not, but you're getting dental coverage, that's not going to serve you so well if you're not getting the right healthcare coverage that you need. One other big difference that I mentioned slightly between these two columns is something called prior authorization. Under column number 1, your doctor determines your medically necessary care. Under column number 2, your doctor can recommend the care, but for some of the bigger services, the managed care companies must give prior authorization. When I was talking about Medicare Part D and those caps, the $3,300 and the $2,000, that also applies to the Medicare Advantage prescription drug coverage. So when you hit that fork in the road, this is what you have to decide between the original Medicare path or the Medicare Advantage plans. Obviously, this is a broad overview, but hopefully this starts and gets you thinking about how the two systems are different and how they're similar.